Ms. Bennett, you mentioned a friend, Destenie, who went to the ER after a Medicaid-funded abortion. Can you tell us more about her story and how that impacted her?
Absolutely. My friend Destenie, she had an abortion at 5 months in Hartford. The abortion providers let her know that she was actually too far along for, based on Connecticut law, but they decided to do it anyway. Supposedly, Connecticut law, although it does pay for abortion, supposedly they're supposed to consider if there's a health issue, but she wasn't asked any questions about her health. As she told me, they just billed the state. After the abortion, she was rushed to the emergency room, and not directly after, but shortly after the abortion, she was rushed to the emergency room, and they found fetal remains inside of her body, which is something that does happen to some women who've had abortion, a botched abortion. There are baby parts that can be left inside of them. And she was in the ER for 3 days, and she really could have died. And if she had died, there would have been no justice for her because she signed papers and they would have just said, well, that's the risk that goes along with abortion. And unfortunately, that's what happens when women have abortions and they're not familiar with the risk and they sign the papers. If something happens to them afterwards, well, it's on them. It was their choice. I know a woman who was a nurse at Yale in New Haven, and she also volunteered at a pregnancy center that I worked for. And she told me how many times women who'd had abortions at other facilities would then come to the emergency room at Yale later on in the night because they couldn't go back to their abortion provider and they had botched abortions, whether that was a perforated uterus, whether that was a blood clot, or whatever it may be.